Have you ever wondered why your legs still feel tired, your calves still ache, or your toes feel cold and numb at night, even though you eat regularly and try to stay active each day? Have you ever felt as if the blood in your body was slowing down, leaving you feeling fatigued, lifeless, short of breath, and lacking the energy to do even the simplest tasks? The truth is, just eating 3 meals a day does not always mean your body is being properly nourished. After the age of 60, your body's ability to absorb nutrients decreases significantly. Some essential vitamins and minerals needed for proper blood circulation gradually become depleted over time. But here is the good news for you. There are specific nutrients that can help expand your blood vessels, improve circulation, reduce numbness, prevent cramps, and ensure oxygen-rich blood flows to all parts of your body. And the best part is, you do not have to look far. Many of these can be found in everyday foods or in safe and easy-to-use dietary supplements. According to the Journal of the American Medical Directors Association, older adults who receive the right vitamin supplements can improve their blood circulation by 25 to 40% within 3 months. That's right. Just a few small changes can lead to a big difference. In the following section, I will guide you through 7 of the most important vitamins and supplements for seniors. These can help improve circulation, reduce the risk of blood clots, support heart function, ease cold and numb hands and feet, and most importantly, protect your legs from dangerous complications. And do not take your eyes off the screen, because number 7 will truly surprise you. It not only boosts circulation, but also helps relieve joint pain, reduce inflammation in the blood vessels, and even protect your memory. Here is what you will learn next. Which vitamin helps naturally dilate blood vessels without needing medication, which mineral can reduce nighttime leg cramps, and which natural food helps keep your blood thin enough to prevent stroke. Are you ready? Let's go step by step together. 1. Vitamin B3, niacin, the key to naturally expanding your blood vessels. If you feel a constant chill in your hands and feet, stiffness in your calves, or need frequent breaks while walking, your blood vessels may be narrowing. Blood cannot flow evenly. It cannot reach where it is needed most. And as a result, your entire circulatory system becomes sluggish. Vitamin B3, also known as niacin, is one of the most important nutrients for improving blood flow by naturally expanding blood vessels. According to a study from the Harvard School of Public Health, niacin has been shown to lower bad LDL cholesterol, raise good HDL cholesterol, and especially help gently widen the blood vessels, allowing blood to flow smoothly to organs and limbs. Your body is like a complex network of pipes. If the pipes become narrow due to fat buildup or aging, blood cannot circulate properly. Niacin acts like a natural pipe expander. It works by stimulating the production of nitric oxide, a molecule that helps soften and widen blood vessels, thereby improving circulation. One practical example comes from a study published in the American Journal of Clinical Nutrition. In this study, individuals over the age of 60 were given 500 mg of niacin daily for 12 weeks. The results showed a 35% increase in blood flow to the legs, along with a noticeable reduction in cold feet, numb fingertips, and calf fatigue while walking. Moreover, niacin also helps enhance brain function. When blood flows better to the brain, you feel more alert. Your memory improves, and you sleep better. Vitamin B3 can be found in the following foods: chicken breast, animal liver, lean beef. Each 100-gram serving may contain 10 to 15 milligrams of niacin. Tuna, salmon, whole grains like brown rice and oats, legumes such as mung beans and red beans, mushrooms, and peanut butter. Additionally, niacin is available as a supplement in doses ranging from 100 to 1,000 milligrams. However, if you plan to take high doses, be sure to consult a doctor, as it may cause a temporary flushing sensation with warmth and redness on the face. Who can benefit from niacin? Older adults who frequently experience cold hands and feet or numbness, people with high cholesterol or high blood pressure, those with peripheral artery disease or who experience leg pain while walking, individuals with mild memory loss or unexplained chronic fatigue. You may begin with 50 to 100 milligrams per day, preferably after meals to reduce stomach irritation. If combined with omega-3 or vitamin B6, the effects can be doubled due to enhanced and stable blood vessel dilation. Have you ever tried niacin? How did you feel after a few weeks? Feel free to share your thoughts in the comments so we can learn from each other. 2. Curcumin, the powerful anti-inflammatory compound from turmeric. The second powerful nutrient for your circulatory system is curcumin, a valuable bioactive compound found in turmeric. You may be familiar with turmeric as a common cooking spice, but few people realize that inside this bright yellow root lies a compound with the power to soothe blood vessels, reduce inflammation, ease swelling, and support smoother blood flow. For people over the age of 60, curcumin is one of the most potent natural anti-inflammatory agents. It is especially helpful for those at risk of atherosclerosis, vein inflammation, or chronic conditions such as diabetes and high blood pressure. When the body is inflamed, the inner walls of blood vessels can become thickened and stiff. This restricts blood flow, forces the heart to work harder, and the limbs, especially the legs, being farthest from the heart, suffer first. This is when you may feel heaviness in your legs, muscle fatigue, a dull numbing sensation, or even mild swelling by the end of the day. Curcumin acts as a natural shield. It blocks inflammatory enzymes like COX-2 and prevents the formation of harmful molecules that damage blood vessel walls. According to a study from Tufts University, older adults who took 500 to 1,000 mg of curcumin daily for 8 weeks showed significant improvement in endothelial function, which means the inner lining of their blood vessels became softer and more flexible, allowing blood to flow more easily and steadily. The same study reported a noticeable decrease in symptoms such as mild headaches, heavy legs from prolonged standing, and unstable blood pressure fluctuations. Curcumin has another remarkable benefit. It helps prevent the formation of blood clots. When blood flow slows down, the risk of clot formation increases. Curcumin reduces platelet stickiness, helping to keep blood thin enough to flow smoothly, without causing bleeding like some chemical blood thinners. Additionally, curcumin helps relieve symptoms of joint pain, knee discomfort, and lower back pain, conditions often associated with poor circulation in older adults. You can consume curcumin through fresh turmeric in meals, or, more conveniently, by taking turmeric extract supplements. Each capsule typically contains around 500 mg of pure curcumin. However, for better absorption, it is best to pair curcumin with black pepper, which contains piperine, a compound that can enhance curcumin absorption by up to 2,000%. You can also find supplement formulas that already include both ingredients. Curcumin is especially suitable for those with vascular issues, arthritis, cold or numb hands and feet due to poor circulation, or individuals managing blood sugar and cholesterol levels. It is safe to take regularly at 500 to 1,000 mg per day, divided into 2 doses after meals. If you are on blood-thinning medication, consult your doctor before using high-dose curcumin to avoid unwanted interactions. Many seniors who have tried curcumin have reported noticeable changes: less joint pain, lighter feeling legs, no more evening heaviness, and especially deeper sleep thanks to better brain oxygenation. Have you ever used turmeric or curcumin? Did you feel any difference in your body after a few weeks? Share your story so we can learn and continue this journey to better health together. 3. Beetroot, the root that boosts nitric oxide production and improves blood circulation. The third powerful food for enhancing blood circulation is beetroot, also known as red beet. At first glance, it may look like a simple reddish vegetable, but inside it holds a secret that can transform the entire circulatory system of older adults. Beetroot is a rich natural source of inorganic nitrate, a compound the body converts into nitric oxide. Nitric oxide is a vital substance that helps blood vessels dilate, become more elastic, and allows blood to flow with greater force and efficiency. To help you understand better, nitric oxide acts like a green traffic light for your blood. When enough nitric oxide is produced, blood flows smoothly through every corner of the body. But when your body lacks it, often due to aging or poor diet, blood flow slows down, the heart must work harder, and the limbs, especially the legs and feet, start to suffer from oxygen deficiency. The clearest symptoms include leg fatigue, muscle cramps, cold toes, or mild ankle swelling. A study from the University of Exeter in the UK showed that middle-aged and elderly individuals who drank beetroot juice daily for 14 consecutive days experienced a significant increase in nitric oxide levels in their blood. This led to improved blood pressure readings, enhanced blood flow to the lower limbs, and notably better mobility in individuals who previously had limited walking ability. Participants in the study not only felt more energized, but were also able to walk farther with less fatigue, all thanks to 1 glass of beetroot juice each morning. In addition to nitric oxide, beetroot also contains folate, vitamin C, and powerful antioxidants like betalain, which help protect blood vessels from damage and reduce systemic inflammation. This is particularly important for older adults, as damaged blood vessels become thickened, prone to fat buildup, and more likely to develop plaque, all of which reduce blood flow. Eating beetroot or taking beetroot supplements regularly can help reduce the risk of atherosclerosis, gently lower blood pressure, improve memory, and fight fatigue caused by poor blood supply to the muscles. As for usage, you can enjoy steamed fresh beetroot, drink beetroot juice, or use beetroot powder mixed with warm water every morning. A daily serving of about 100 to 150 grams of fresh beetroot or 1 teaspoon of beetroot powder is enough to create a vasodilation effect, lasting up to 24 hours. If you want a more potent result, you can try beetroot extract capsules, which usually contain 500 to 1,000 milligrams of plant-derived nitrates, safe and suitable for older adults. One small note, beetroot can cause your urine or stool to appear pink, but this is completely normal and harmless. However, if you have a history of kidney stones or are taking blood pressure medication, consult your doctor before using high doses of beetroot, as nitrates may slightly lower blood pressure. Have you ever tried drinking beetroot juice? Did you notice your body feeling lighter, your legs less tired after a few days? Share your experience. Your story might inspire someone else to take better care of their heart and circulation. 4. Garlic, the familiar bulb that naturally cleans your blood vessels and enhances circulation. The next food you should not overlook if you want to improve your blood circulation is garlic. It is a common ingredient in most Vietnamese kitchens, but what makes it truly remarkable is that garlic is not just a spice. It is also a valuable medicinal food for the heart and blood vessels. Garlic contains a special compound called allicin. This is the key substance responsible for garlic's powerful healing effects. When you crush or chop raw garlic, allicin is released. Once inside the body, it acts as a natural vasodilator. It helps blood vessels expand, increases the amount of blood flowing through them, and in turn, improves circulation from the heart to distant areas such as the hands and feet. This is especially important for older adults because over time, blood vessels tend to become stiff, thickened, and narrow. As a result, the heart has to work harder, and the limbs are frequently cold, numb, or weak during movement. Numerous studies have shown that garlic can lower blood pressure, reduce cholesterol, and prevent blood clots from forming in artery walls. A report from McMaster University in Canada found that taking 600 to 1,200 milligallons of garlic extract daily for 3 months reduced systolic blood pressure by up to 10%. It also increased the flexibility of blood vessel walls in people over 60. Those who used garlic regularly also reported less finger numbness, reduced foot swelling, and felt less leg fatigue when walking in the late afternoon. Garlic also has the ability to inhibit the oxidation of LDL cholesterol, which is a major contributor to artery blockage and stroke. Additionally, garlic's natural anti-inflammatory and antibacterial properties help cleanse blood vessels and prevent hidden inflammation in the cardiovascular system, something many older adults may not even realize they are experiencing. How to use garlic effectively. You can eat raw garlic that has been crushed and left to sit for 10 to 15 minutes before meals. Just 1 to 2 cloves per day are enough to bring about the desired effects. If you do not enjoy the strong flavor of raw garlic, you can use odorless garlic capsules made from purified allicin. Each capsule typically contains 300 to 600 milliliters and can be taken once or twice a day after meals. Some products are also enriched with fish oil or vitamin E to enhance antioxidant power, which is very beneficial for people with atherosclerosis. Caution: if you are taking blood-thinning medications such as aspirin or warfarin, consult your doctor before using high-dose garlic, as garlic also has a mild blood-thinning effect. However, in daily food doses or low-dose supplements, garlic is completely safe for most seniors and provides many practical health benefits. Do you eat garlic every day? Have you ever tried drinking garlic water in the morning? You may be surprised at how much lighter you feel after just a few weeks of use. Please feel free to share your story. Your experience might help many other older adults improve their health too. 5. L-Arginine, the special amino acid that nourishes blood vessels and supports circulation to your limbs. The next essential nutrient that plays a key role in improving blood circulation in older adults is L-Arginine. This is an amino acid that the body can produce in small amounts, but most of it needs to come from food or supplements. You may not have heard of this compound before, but it is the main building block used by your body to produce nitric oxide, the same substance we mentioned earlier when talking about beetroot. Nitric oxide helps blood vessels dilate, blood flow improve, heart workload decrease, and circulation to the limbs and weakening muscles increase, all of which are especially important as we age. In older adults, the amount of L-Arginine in the body tends to drop significantly, which leads to reduced nitric oxide production. As a result, blood vessels lose their flexibility and become more prone to narrowing. Blood flow slows down, leading to cold hands and feet, leg fatigue while walking, or mild chest discomfort during physical exertion. That is why L-Arginine is considered a safe and effective natural aid for promoting circulation, especially for seniors who experience intermittent claudication or people with diabetes-related circulation issues in the lower limbs. According to a study published in the International Journal of Cardiology, taking 3,000 to 6,000 milligrams of L-Arginine daily for 6 weeks improved blood flow in patients with peripheral artery disease. These individuals could walk farther without experiencing leg pain, and also saw a reduction in diastolic blood pressure if they had mild hypertension. The same study reported clear improvements in blood vessel dilation and oxygen saturation levels in muscle tissue after just 3 weeks of consistent use. You can get L-Arginine from high-protein foods like chicken, salmon, eggs, Greek yogurt, almonds, peanuts, and soybeans. However, to achieve therapeutic effects, the required amount is often higher than what food can provide. That is why L-Arginine supplements are widely recommended by cardiovascular experts. Most L-Arginine supplements come in doses of 500 to 1,000 milligrams per capsule. You can take 2 to 3 capsules per day, divided into 2 doses after meals. Some formulas also combine L-Arginine with vitamin C, L-citrulline, or vitamin B6 to enhance absorption and prolong the effects of nitric oxide in the bloodstream. It is best to start with a low dose and monitor your body's response. If you notice good results, you can continue using it as part of your daily heart and circulation health routine. Important precautions. People with serious liver disease, chronic kidney disease, or those being treated for coronary artery disease should consult a doctor before taking high doses of L-Arginine. Also, if you are using vasodilator medications, monitor your blood pressure regularly to avoid unexpected drops in blood pressure. Have you heard of L-Arginine before? If not, this may be the perfect time to explore a natural, science-backed way to promote smoother blood flow, a gentler heartbeat, and legs that no longer ache or feel tired. Please share your experience so we can all learn together and support long-term health in a sustainable way. 6. Capsaicin, the natural compound in chili peppers that warms the limbs and stimulates blood flow. The 6th nutrient with excellent benefits for blood circulation, especially in the hands and feet, where older adults often experience coldness, numbness, or heaviness, is capsaicin, a natural compound found in red chili peppers and other spicy varieties. Even if you are not a fan of spicy food, what capsaicin does for your blood vessels and circulatory system is truly worth considering. Capsaicin works as a natural circulatory stimulant. It promotes stronger blood flow, especially to areas far from the heart, such as your fingertips, toes, and even the scalp. That warm sensation you feel after eating spicy food is not random. It is caused by capsaicin-stimulating heat receptors on the skin, which then temporarily dilate blood vessels and increase blood flow to those areas. A study from Harvard University showed that when older adults consumed capsaicin regularly, either through food or supplements, the peripheral temperature of their palms and soles increased by 1 to 2 degrees Celsius within just 30 minutes. This was accompanied by noticeable improvements in cold extremities, leg fatigue after prolonged standing, and deep nighttime chills. Capsaicin also has the ability to reduce bad cholesterol, prevent plaque formation inside arteries, and provide strong anti-inflammatory protection, which helps shield blood vessels from oxidative stress and damage. Beyond its circulation-boosting effects, capsaicin is known to relieve mild to moderate pain by blocking substance P, a chemical messenger involved in pain signaling. This is why capsaicin is used in treatments for diabetic nerve pain and peripheral neuropathy in older adults. Today, many capsaicin creams are also used to relieve back pain, joint stiffness, or neck and shoulder tension by promoting local circulation and warming deep muscle tissues. How to use capsaicin. You can get capsaicin through fresh or dried chili peppers, chili powder, or capsule supplements. Each capsule typically contains 100 to 300 mg of capsaicin, and you may take 1 to 2 capsules daily after meals. If you are sensitive to spicy flavors, the capsule form is an ideal choice because it does not cause mouth burning or digestive discomfort like raw chili. Additionally, some warming herbal teas that include ginger and chili can be consumed in the morning or during cold weather to gently stimulate circulation. Important note: if you have gastric ulcers, severe acid reflux, or are recovering from acute intestinal inflammation, avoid high-dose capsaicin, as it may irritate the stomach lining. For otherwise healthy individuals, capsaicin is a natural, effective, and pleasantly warming aid that can improve blood flow to your hands and feet within just a few days of consistent use. Do you often suffer from cold feet at night? Have you ever tried using chili to naturally warm up your body? Capsaicin might just be the solution you are looking for. Simple, effective, and science-supported. It helps blood move better, reduces pain, and relieves the icy discomfort that may have been robbing you of sleep on winter nights. 7. Omega-3, the most important compound for protecting blood vessels and enhancing full-body circulation. Omega-3 is an essential fatty acid found abundantly in fatty fish, such as salmon, mackerel, sardines, as well as in flaxseed oil, chia seed oil, and walnut oil. Omega-3 has been confirmed by hundreds of scientific studies to have powerful effects on cardiovascular health. It reduces inflammation in blood vessels, naturally thins the blood, lowers triglyceride levels, and increases the elasticity of arterial walls. As a result, blood flows more strongly, smoothly, and with a reduced risk of blockage. For older adults, the role of omega-3 is more important than ever. Once you pass age 60, blood vessels begin to stiffen. Fat and plaque accumulate more easily, and triglyceride levels tend to rise. These are the exact conditions that lead to high blood pressure, stroke, and heart disease. Omega-3 not only helps cleanse the blood vessels, but also acts like a soft protective layer around each cell, keeping blood vessel cells flexible and preventing the formation of dangerous blood clots, a key cause of sudden cardiovascular events. A large-scale study by Harvard University showed that seniors over 65 who took 1,000 to 2,000 millimoles of omega-3 daily for 12 weeks experienced significantly improved blood flow to their lower limbs. They also had reduced systolic blood pressure by 5 to 10 millimoles, fewer headaches, less numbness in the hands, warmer feet, and, most importantly, noticeable improvement in short-term memory. This means omega-3 not only benefits the heart, but also enhances blood flow to the brain, helping older adults stay mentally sharp and avoid early cognitive decline. You can add omega-3 to your diet by eating fatty fish at least twice per week, or by taking fish oil capsules. Each capsule usually contains 500 to 1,000 milliliters of omega-3, with key components being EPA and DHA. EPA is known for its strong anti-inflammatory effects and ability to dilate blood vessels, while DHA is especially vital for brain and eye health. For vegetarians or those who dislike the smell of fish oil, algae-based omega-3 is a safe and easily absorbed alternative that still provides all the essential benefits. If you are taking blood-thinning medications or antihypertensive drugs, consult your doctor to choose an appropriate dosage, which is typically around 100 millimoles per day. Omega-3 should be taken after meals to optimize absorption and reduce the chance of digestive upset. For seniors at risk of heart disease, diabetes, or poor circulation, regular omega-3 supplementation is one of the simplest and most effective ways to prevent stroke and improve daily quality of life. Are you currently taking fish oil or omega-3 every day? If so, have you noticed better memory, warmer limbs, or a more relaxed and calm feeling? Share your honest experience. Your small piece of advice could be just what someone else needs to make a confident step toward better health. Dear friend, we have now explored a precious list of 7 vitamins and nutrients that support healthy blood circulation, all backed by science and especially suitable for older adults. From niacin that helps dilate blood vessels, to curcumin that soothes inflamed veins, from beetroot that boosts nitric oxide, to garlic that cleanses the blood, L-Arginine that nourishes the vascular system, capsaicin that warms the limbs, and finally, omega-3 that keeps the heart steady and the mind sharp. Each of these nutrients is like a small building block, and when combined, they can construct a strong, efficient circulatory system that nourishes your entire body, from your heart all the way to your toes. The most important thing is not to take everything at once. The key is to choose a starting point and maintain it every day. Maybe today, you begin by adding a little turmeric to your soup. Tomorrow, you try drinking beetroot juice before breakfast. And next week, you order a good quality bottle of fish oil to start supplementing omega-3. These small changes will accumulate into big results. When your blood flows better, you will clearly feel the difference. Your hands and feet will feel warmer at night. You will no longer feel heaviness or knee pain while walking. Your memory will become sharper, and every step will feel lighter. Blood circulation does more than nourish muscles and joints. It is the lifeline of your entire body. And the most wonderful part is, you have the power to take control of it, starting with the healthy nutrients you have just learned about today. Please feel free to leave a comment and share with me. Which of these vitamins or nutrients are you currently using? Which one surprised you the most? I am always happy to hear your health journey and support you along the way. If you found today's content helpful, please tap the like button and subscribe to the channel so you will not miss the upcoming episodes. Because we still have a very important journey ahead. In the next part, I will show you simple daily lifestyle changes, from gentle exercises, correct sleeping postures, healthy eating, to evening habits, that can boost your blood circulation naturally, without medication, without complexity, but with real, visible results. I wish you great health, strong legs, warm hands, and a happy heart. See you in the next video.